hello there. I'm sorry. I was just doing some studying. How are you? Okay. Yeah, no, that's fine. You are right on time, actually. Okay. So, just confirm your name for me, your full name. Perfect, thank you so much. And your date of birth? Great, that's excellent. Alright. Well, my name's Bryoni. I'm a medical student. So, I'll be carrying out your cardiology appointment today. Alright? So, just to begin with, I need to just ask you some questions just based on your current health history. Okay? So, have you ever been diagnosed with any heart problems or heart disease? Okay. And have you ever been hospitalised because of that? Okay. And have you ever experienced any of the following? Pain or discomfort in the chest, in the arms, throat, jaw, or your upper back? Okay. Do you ever get shortness of breath? Okay. And do you struggle normally to sort of mobilise, get up the stairs without getting shortness of breath? Okay, that's fine. Do you suffer from high blood pressure? Okay, you're not sure. That's fine, we'll check your blood pressure today anyway. Okay, do you currently have a fever? Okay, do you ever get palpitations? Skipped beats? Okay, do you know if you have an abnormal heart rhythm? Okay, do you ever get blackouts or fainting spells? Okay, any dizziness, lightheadedness? Okay, do you ever get cramps in your legs, primarily when you're walking or laying down at night? Okay, do you have history of blood clots? Okay, have you ever had an abnormal ECG? Okay, alright. And have you ever had any of the following cardiac tests done? Have you ever had an exercise stress test or a treadmill test? Okay, what about an echocardiogram? That's an ultrasound of your heart. Okay, have you ever had a monitoring device? Okay, and what about an electrophysiologic study? Okay, you would know about it if you did. Okay, alright, everything's looking fine so far. Have you ever had surgery? Okay, that's fine, and you don't have a pacemaker? Okay. Have you ever been shocked? Okay. It's always good to know. Okay. Alright, and are you on any current medications? Okay. You want any blood thinners? Okay. And do you have any allergies to any medications? Okay. No, that's absolutely fine. No. Have you ever had any injuries or broken bones? Okay. Alright, that's fine. No, that's all good. Almost done. Have you ever had a blood transfusion? Okay. That's fine. And do you have any of the following? Diabetes? Have you ever had a stroke? Okay. What about kidney disease? Or a severe illness? Okay. That's fine. Okay, do you currently smoke? Okay. Do you drink alcohol? Okay, how many units per week? Okay. Do you wear any lenses, contact lenses? Okay, do you have glaucoma? Do you have cataracts? Okay, do you have any visual impairments? Okay, do you have any hearing impairments? Okay, any hearing aids? Okay, do you have any sinuses problems? No. Do you wear dentures? Okay. So we just have to ask. Okay, do you have any headaches? Recurring headaches? No. About migraines? Okay. Have you ever had pneumonia? How about, do you have asthma? Okay, have you ever had tuberculosis? Okay. Have you ever had a chronic cough? Okay. And have you ever coughed up blood? Okay. Okay, that's fine. Alright, that is pretty much everything that I needed to go through. It's just so I know your medical history and just a little bit about you. Can you just tell me what it is you've been experiencing, just so I'm aware? Shortness of breath. Okay. Okay. Any headaches or anything? Okay. Alright. Well, I think you're okay, but we'll check anyway. So what I'm going to do, just going to check your breathing. Okay. So what I would like you to do is just breathe normally for me. Okay. Take a nice deep breath in. Alright, good. Okay. Take a nice deep breath in. And out. Good. Take a nice deep breath in. And out. Very good. Take a nice deep breath in. And out. Excellent. Okay. I'm just going to have a little listen. Okay, just breathe normally. Okay, now take a nice deep breath in for me. And out. Good. Take a nice deep breath in. And out. Excellent. Take a nice deep breath in. And out. Good. Take a nice deep breath in. And out. Okay, I'm just going to do your back. Okay, take a nice deep breath in. And out. Okay, take a nice deep breath in. And out. Okay, one more. Take a nice deep breath in. And out. Okay, good. Alright, that sounds fine. Your lungs also sound okay. You don't sound chesty or anything at all. Everything sounds okay. Alright, so what I'm going to do, I'm just going to check your pulse. So just pass me your arm. Okay, just have a little feel. I'm just going to count your heart rate. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60, 61, 62, 63, 64, 65, 66, 67, 68, 69, 70, 71, 72, 73, 74, 75, 76, 77, 78, 79, 80, 81, 82, 83, 84, 85, 86, 87, 88, 89, 90, 91, 92, 93, 94, 95, 96, 97, 98, 99, 100, 101, 102, 103, 104, 105, 106, 107, 108, 109, 110, 111, 112, 113, 114, 115, 116, 117, 118, 119, 120, 121, Okay, that's fine. So your heart rate is 83. Alright, so that's all good. Okay, so 3 heart rate and your breathing is fine. Okay, what I'm going to do now, I'm just going to check your oxygen saturation levels, okay? I just want to make sure that your oxygen levels are fine, especially if you're feeling a little bit out of breath here and there. Okay, so what I would like you to do is just put your finger in here for me. That's it. Okay, good. So it should be above 96. Good, so yours is 98%, that's excellent, and your pulse is saying 74, so that's also good, okay? But this just checks your pulse automatically, manually is more reliable, okay? So that's great, thank you. And next up, I'm just going to check your blood pressure. I just want to see if you're hypertensive or anything, okay? So have you had your blood pressure checked before? Numerous times, okay. Okay, so you're going to pop this one on your arm. That's it, it needs to be that way round. The tubing needs to be along the same side as your main artery. Okay, so that's it, put that there. Okay then, alright, so we're just going to turn it on. Just relax your arm down by your side. And just relax. It should start to inflate now. There we go. Okay. And in a few moments it will start to deflate. Okay, so just bear with. So a normal blood pressure is 120/80, but there's some leeway either side, probably about 10 either side, it's fine. Okay, so your blood pressure is actually 102/75 and your pulse is 73. What I want to do, I just want to switch arms. Okay, so I'm just going to try it again on the other side. So just pop your arm in there for me. Perfect. Let's twist that round ever so slightly. That's it. Okay, and just relax your arm down for me. We're just going to repeat that, okay? Do you feel dizzy at all? Okay. Yeah, your blood pressure is just borderline sort of low, but it's okay. Sometimes it happens. And have you had something to drink and eat today already? Yeah, maybe you need a little bit more water. Has it gone much tighter this time? It has? Okay. That's alright. Okay, it should just start deflating now. Oh, that's much better. So your blood pressure is 121/89. Okay, and your pulse is 71. Alright, so you have absolutely nothing to worry about. Sometimes it's better on one arm than the other. Yes. Okay. So what I'm going to get you to do now, I'm going to get you just to do a little bit of exercise, okay, just for about 15 seconds, and I just want to check your heart rate after that. Okay, just want to do a little test. So just sit where you are, and you can either decide to do some squats or just move side to side like this, but you need to sort of do it at a pace we can go quite quickly. Okay? Alright, ready? You choose. I will count to 15. Okay, so either do some squats or move your body from side to side like this. Alright? Ready? Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Perfect. Take a seat. Alright, get your breath back, okay? And just try and relax, okay? I just want to see how long it takes you to recover from doing some exercise. So I'm just going to have a little listen on your chest. I'm just going to pop that one there. Okay, and take a nice deep breath in for me. And out. Good. Take a nice deep breath in. And out. Very good. Take a nice deep breath in. And out. Take a nice deep breath in. And out. Excellent. Okay. Well, that all sounds fine. It sounds a little bit faster, but that's expected as you've just done some exercise. Okay. I'm just going to check your pulse again, so just pass me your wrist. Perfect. Okay. 1, 2, 3. Yeah, that's okay. I'm just checking half because I just need to see if it elevated, and it's just a sort of moderate, so that's fine. So what I would like you to do is just take some nice deep breath in for me. Okay. Well, this is the end of your examination, okay? I don't think there's any concerns immediately, but what I will do, I'm going to refer you to have an ECG done just to make sure. Okay, so we cannot do that today, but I will send off a referral for you to get that done. But everything else seems okay. Your blood pressure's fine, your oxygen levels are fine. You have recovered well since doing a short exercise, which is great. But I would like to see an ECG. Okay, so we'll get that referred for you. So you'll get that in the post, and then you just go and have that done. Alright? No problem. Take a deep breath in and out. Good. Take a nice deep breath in and out. Very good. So I've got here that I just need to run a full set of observations on you. Okay? So I will need you just to remain where you are, just sit and just try and calm yourself just for a couple of minutes before we begin. Okay? So to run a full set of observations, I do need to check your temperature, okay, your heart rate, your respiratory rate, your oxygen saturation levels, your blood pressure, okay, and I will just check your breathing just as an extra precaution, and I also just want to have a look at your pupil dilation. Now those two are not usually included in our patient ops, but I would like to check them on you, okay? Is that alright? Perfect. Okay. Well, I do have a observation chart here for you, okay, and I just need to pop your details on here, so while you just stay relaxed, we'll fill in this part. So just to let you know, this is for the NHS, and it's the new score, the early warnings score, okay? So I just need to take your full name. Okay, and your date of birth. Perfect. And today's date is the... Okay. Alright, that is pretty much everything. So this is the chart that I will be popping on your results, okay? And then at the end we get a score. So the lower the score, the healthier it is, or the less concerned we are. And the higher the score, the more of a risk you are of experiencing things, okay? So to begin with, I'm just going to check your respiratory rate for 60 seconds, okay? So just breathe normally, okay? And the time will start now. just going to pop your results on here. So you had 17. So you actually scored a 0. Okay, so your respiratory rate is the amount of times that you take a deep breath in and out, okay, and it's counted for 1 minute. So you had 17. So we would be concerned if it's anything sort of less than 10 and anything over 20, okay? So between 10 and 20 you're sort of okay, alright? So next up I'm just going to check your oxygen saturation levels. Now this is to check the oxygen, and we use a little device like this, and it should typically be between, for a healthy person without any sort of comorbidities, without any oxygen problems, for example COPD or any airway respiratory problems, should be between 96% and 100%. You can't exceed 100%, but you can be between 96 and 100, and that would be a regular healthy person as such. So I'm going to pop this on your finger. I'm going to turn it on, okay? It will make a beeping sound, so just hold your finger out like this. Okay, and then just pop your finger in for me. Good. Takes a few seconds to fully register. Okay, we'll just have a little look. So this one is saying that your saturation levels are 95%. So you're just under the cusp. Now this also has your pulse rate on it, so we can see that. And it's currently between 74 and 83. It is fluctuating, but that's probably because I'm talking to you. And just take a nice deep breath in. I want to try and just reach 96 for your saturation. So a deep breath in and out, and in and out. We reached 96, but it's dropped back to 95, so that's fine, that's okay. You are sort of on par. Alright, we're just going to take that one off. Okay, I'm going to pop that one aside. Now, although we had your heart rate on there, I am going to manually check it. Okay, so your oxygen levels were 96 and also 95 at times. So 96 would score a 0. However, I'm going to put it as 1 just because it was mainly 95 and we couldn't get up unless you took those nice deep breaths. So your heart rate did range between 74 and 83. So I do just want to manually check your heart rate. So what I'd like you to do is pop your arm out, and I'm just going to have a little feel. Okay. So pop your arm out, and I'm just going to feel here. Okay, just on the side where your thumb is. That's it. Okay, got it. 2, 3, 5, 8, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60, 61, 62, 63, 64, 65, 66, 67, 68, 69, 70, 71, 72, 73, 74, 75, 76, 77, 78, 79, 80, 81, 82, 83, 84, 85, 86, 87, 88, 89, 90, 91, 92, 93, 94, 95, 96, 97, 98, 99, 100, 101, 102, 103, 104, 105, 106, 107, 108, 109, 110, 111, 112, 113, 114, 115, 116, 117, 118, 119, 120, 121, 122, 123, 124, 125, 126, 127, 128, 129, 130, 131, 132, was actually 70 exactly, so that's very good. I will just pop down that it was actually 70 and you score a 0. So I like to do it manually because although the devices are really good at picking it up, at some point when you feel it manually on somebody, you can actually feel the rhythm, whether at that time if it is fast for a short few seconds or slow for a few seconds. But if you do it for a minute, overall it will be the accurate minute for the beats per minute. However, it's also good because if it slows down for a few seconds, you can actually feel it when you feel the pulse. Now the things with the devices, how it jumps from say 70 to 80 so quickly, unless you have an arrhythmia, it's kind of just picking up the beat sort of for that few seconds and then it averages it out. Yes. So a normal sort of heart rate would be between probably 60 to 90. Anything below 60 you have a slow heart rate and we call that bradycardia. And anything over sort of 90, hundreds, that's tachycardia and that's quite fast. That is very fast. We would be concerned. But at the moment, that's okay. So next up, I'm just going to check your temperature. Now for this one, it's very quick. I have it just in my medical bag. Here it is. And this one just goes, it can either go under your tongue or under your arm. Where would you prefer? Under your tongue. Okay. So I'm looking for anything above 36.1 till about 37.4. 37.4 might indicate you have an infection of some kind or you're unwell. Under 36.1 your body is cold, okay? So I just want to check to see if you have a fever. So I'm just going to pop this on. Okay, and if you just open your mouth and just lift your tongue up. Okay, I'm just going to hold that. 1, 2, 3, 4, 5. Okay, there we go. Let's have a little look. So it's actually 36.4, so your temperature is absolutely fine. So let's just pop that on here. 36.4 and you scored a 0. Perfect. Okay, we're just going to check your blood pressure. Okay, so I do have a automatic blood pressure machine here. Now, have you had one of these done before? Good. Okay, so quite simple. This one's really quickly. It's I just plug it in, pop this on your arm, and it will work it out. Now, the normal blood pressure would be 120 systolic over 80 diastolic. Now, based on your sort of fitness levels and how you have been so far, I'd probably suggest that yours might be between 110 to 130 and then maybe 60 to 80 diastolic, okay? So, what I'm going to do, you just need to pop your arm out like this and I'll use this side, okay? So I'm just going to connect it. And we're just going to pop that on your arm, so if you can just pop that on for me. That's it. I need to just pop the sort of the wire where your artery would be. That's it, just so it's near your pulse. So we also get heart rate on here as well, so we can see if it all matches. Alright, is that secure and firm? Okay. So what I'm going to do, I'm just going to press the button. Okay. Okay, so I just press start and it will go. Just stay where you are, keep your arm nice and still and just relax. There we go. Should be going up now. It will be a bit tight, but don't worry, it won't last long. Is it tight? Okay. So if you just wait a few seconds, even though it's quite tight on your arm, it will slowly start to go down, okay? So it's just counting down for me now. Perfect. Okay, so your blood pressure is actually in the normal range at the moment. It's 116/89, and your pulse is saying 76. So your pulse has been aligned for, it's been fine for the saturation one, it's fine on this one, and when I checked it manually, it's all fine. So this is your current score, okay? So let's just take that one off your arm. How was that for you? Not so bad? Okay. Alright, I'm just going to unplug this. And back in the bag. And we're pretty much nearly done. Okay. So I just want to check your pupil response next, alright? But that is everything on this form. So your blood pressure was 116/89 and your heart rate was 7. Perfect. So in terms of the news score, you only scored a 1, which was for your oxygen saturation level, so you're absolutely fine, there's nothing wrong. You're okay at the moment, alright? So that's all done, but what I'm just going to do, I just want to have a quick look at your pupil response, okay? So just have a little look at my nose and keep staring at my nose. Okay. Okay, that's good. That's good. And that one's good as well. Okay. Yep, that's fine. That one's fine. Okay, that's all good. And finally, I just want to check your breathing. Okay. So, I'm just gonna pop these in. Alright, and this one's just gonna go on your chest. Okay? So just lift your top. Perfect. Okay, take a nice deep breath in. And out. Good. Take a nice deep breath in. And out. Great. Okay, so everything sounds absolutely fine. Your pupil response was good, your eyes are corresponding perfectly, and your observations were fine. I honestly have no concerns. You're doing really, really well. So first of all, I just need to fill out this form. Okay, so could you just tell me your surname? Okay, and your first name? Great. And what's your date of birth? Thank you. And do you know the name of your GP practice? Okay. Great. Okay. Now I just need to ask you some random medical questions and questions about your hearing and your ears. Is that okay? Good. Alright. So once we've done all of these questions, we will then begin the tests. Okay? Shouldn't take too long though. So do you live alone or with somebody? Okay. And what's your occupation? What do you spend most of your time doing? Okay. And have you noticed any difficulties while doing your job regarding your hearing or your ears in general? Okay. I guess, does it affect your day-to-day activities or whatever it is that you're doing? Okay. So this is just a checkup pretty much. Okay. Alright, so let's have a little look. So, how long would you say you've had some sort of problem with your hearing? I don't want to use the word problem because sometimes things can be difficult to hear, and that's okay. But how long would you say? Okay, not too long. It's good you came to get assessed. And which is, or is it both, do you struggle most with? Okay. Great, thank you. So the next set of questions are just yes or no, and these are just generic questions that I have to ask you. Okay. So have you had any sudden or rapid changes in your hearing within the last 90 days? Okay. Does your hearing change on different days? Okay. Do you get pain in your ears? Okay. Do you get any infections or discharge from your ears, not including wax? Okay. And have you had any ear-related operations? Okay. Have you ever had a perforated eardrum? You'd know about it if you did. Yes. And do you hear any rushing, hissing, ringing, beating, pulsing, or any other noises in your ears? Okay. And do you have a strong sensitivity to everyday loud sounds that typically do not bother other people? Okay, so sometimes. Which noises are they? Is it loud music? Right, okay. Alright, that's fine, thank you. Do you ever see a ears, nose and throat ENT specialist? Okay. Do you have hearing aids? Okay. And do you ever get dizziness or any problems regarding dizziness? Okay. Alright. We're nearly there. Okay. So, I have some more questions to ask you. These are yes or no questions again. So, have you ever been exposed to significant noise in your life? Has anyone in your family had a hearing loss not associated with aging? Okay. Do you have any skin allergies? Okay. Do you have any altered sensation in your face, like numbness or tingling or droop? I don't think you do. Have you ever taken any medication that you were told may affect your hearing? Okay. Have you had any injuries around your ears or your head? Okay. Do you have any problems with your eyesight, with or without glasses? And how severe is that? Okay, it's fine. Do you have problems with the feeling or movement in your fingers? For example, do you have trouble doing up buttons or unscrewing things? Okay. Do you have any difficulties with your memory? Okay. Alright, so let's just double check. Okay, so finally the last set of questions are about your hearing difficulties. So these are if your hearing is affected in these kinds of situations, okay? So again, just say yes or no. So I'm going to give you one of these. For example, one-to-one conversation in quiet. Do you have difficulty hearing in one-to-one situations? Okay. How about conversation with noises? Sort of background noises? Okay. Do you have any difficulty hearing the television or radio at a normal volume? Do you ever have difficulty hearing a familiar speaker on the telephone? How about an unfamiliar speaker? Sometimes. Do you have difficulty hearing the doorbell? Or knocking? Okay. Do you have difficulty hearing traffic? You can hear the traffic now? Well, that's great. How about hearing the fire alarm? Okay. Alright. I'm pretty happy with the results so far. I don't think there's anything that I'm sort of immediately concerned about. However, I do have a few things that I am going to do. First of all, I'm just going to put some gloves on. And I'm just going to have a little feel around of your ears. I will then have a little look in your ears, just to make sure I don't see anything that concerns me. I will then just conduct a few hearing tests. One will be whispering into your ear, okay? And I will then do some sort of hand movements to see if you can hear them. And then also I have a little machine here, just this machine, and it will play some sounds and I will change the volume, and I just want you to tell me if and when you can hear it, okay? So that's how the rest of this will go, alright? So I'm just going to touch your ears. I just want to have a little feel. Feels okay. Do you have any pain at all? No. Okay. Your ears feel fine. There's no lumps, bumps, and they don't look red at all. Your ears look okay. Yeah, and there's no pain when I'm touching. No. Okay. You don't have any pain sort of here on your face? No. What about sort of under your jaw here? Any pain? No pain. Sure? What about your cheeks? Any pain? No. Good. Alright, I'm going to just have a little look with this light and this tool. Okay, I'm just going to have a little look. That ear looks okay. I'm just going to check this side. Good. This one looks fine as well. Alright. What I'm going to do, I'm just going to use my light with a magnify on. Just going to check the other side. They both look okay. Did you hear the car? Yeah, okay. I'm not really concerned at your hearing, but let's have another little look. I'm going to use a bigger magnifying glass, okay? Just want to have a little look. Okay, that's fine. This side. Yeah, that looks fine. Just gonna have a little look with this light. Yeah, it's fine. This side. Yeah. Okay, your eyes look fine. I'm not concerned at all, actually. Okay. What I'm going to do next, I'm going to whisper into each of your ears, okay? And just repeat back to me exactly what I say. Alright? Hello. My name is Bryoni. What did I say? Very good. Okay. I hope you've had a very good day today. What did I say? Very good. Okay. Coconut, mango, apple. Coconut, mango, apple. Very good. Cat, piano, dog. Good. Very good. Excellent, well done. 10, 5, 2, 1. Good. 8, 7, 4, 5. Perfect. Let's do 2 more. Happy, sad, good. Hello, 5, cat, 10. Very good. Okay, what I'm going to do now, I'm going to hold my hands like this, and I am actually going to move them, and I want you just to tell me which side you can hear the sounds, okay? So left or right? Alright. Which side? Good. Which side? Good. Which side? Which side? Look at my nose. Which side? Good. Which side? Which side? Which side? Which side? Very good. Which side? Which side? Which side? Which side? Both? Which side? Good. Which side? Which side? Which side? Which side? Okay. You did really, really well there. Okay. So, your ears are fine. Okay. Well, you've passed those 2 tests. And finally, the last test is with this machine. Okay. Now, it might be a tad bit loud. So what I'm going to do, I'm going to play a sound, and I want you to tell me what you can hear, okay? Alright. Okay. What do you hear? A song? Good. Okay, let's change it. What do you hear now? What do you hear? Good. What do you hear now? Just a bit louder. Is it the same on both sides? Good. Okay. What does this sound like to you? Good. What does this sound like? Water. Bubbles. Boiling. Very good. What does this sound like? The waves. It's water. Good. What does this sound like? Fire crackling. Very good. What does this sound like? Very good. And finally, what does this sound like? Clock. Very good. Well, I think you have done extremely well there. I don't think there's any problems at all with your ears, and your hearing is fine actually. Very good hearing, extremely good hearing actually, for that matter. Everything's fine. I think we're going to do another checkup maybe in a few months. I do ever so quickly just want to measure your ears. Okay. Yeah, your ears are fine. So everything was absolutely fine today. You've responded really well, and I don't have any concerns at all. Do you have anything for me? No? Well, you are good to go. And yeah, please do not worry. If anything changes, please do come back and see me. But other than that, I will request to see you again in a few months. Alright? Very good. You are more than welcome. So, I am just going to ask you some questions. How have you been feeling? Sort of your day-to-day self? Are you well? Okay, good. No concerns. Are you in any pain at all regarding your mouth, your teeth, or your gums? Okay. And do you have any current swelling? Okay. Any sores at all? Okay, any ulcers? No. You don't have any cracked lips? Nope. Okay. And how is your throat? You're not sore at all? No. Okay. So just to check up then. You've got no concerns at all that you need to run by me regarding your mouth? No? Okay. Alright. So what I'm going to do, I'm just going to pop some gloves on. Alright. And we'll have a little look at your teeth, okay? I just need to ask you, did you fill the form out given to you from my lovely receptionist? Yes. That's the one, you just give it back to her on your way out. Okay? Alright, let's have a little look at your teeth. Okay, I'm just gonna go. open your mouth. Oh. I'm just going to put a mask on. I don't think you've brushed your teeth before you've come to see me. Okay? It's okay. I just pop one on sometimes. Okay. Hopefully you can hear me alright. So let's just have another little look. Open up wide. Good. Keep your mouth open. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Just gonna check the top. You've got a slight bit of food there. I'm just going to clean that. Okay, I'm just going to use this brush. Just want to give you a little clean. And at the top. Good. Sorry. It's okay. Honestly, it's fine. I'm used to it. Alright. Just going to have a little look again. Okay. So I got 1, 2, Alright, that looks fine. I'm just going to use my magnifying glass just for one moment, because I think you've been grinding your teeth in your sleep. Yes, do you usually grind, do you know? It's very common. Please don't worry if you do. You've never noticed it? Okay, I'm just going to have a little close up at your front teeth. Okay, at the bottom they're looking a little bumpy. Yes, I'm just going to have a little look, okay? Let's just alright. Okay. It looks like you have been grinding your teeth. Okay, so I'm going to have to fit you a mouth guard. Is that alright? Please do not worry. The rest of your teeth are absolutely fine. I've got no concerns with them. I've thoroughly checked all of your teeth. The only thing I noticed was that the front of your teeth, they're a little gnawed or bumpy. They're not as straight, and they can suggest that you've been grinding your teeth while you've been sleeping. It's the most common. I don't think you walk around day to day grinding your teeth, so I only assume it's at night time. So are you happy for me to fit a mouth guard? It won't take long, a few minutes. It's all included within your appointment. Please do not worry. Okay, great. Alright, so I've just got a clean one here. Okay, so I've just got you your own box. Alright. So what we're gonna do, I've got a clean packaging here. Alright, and it comes with its own box. Okay, we're only going to fit one, okay, and it's just going to go on the bottom of your teeth, so that when you close your teeth, your top teeth will balance on the mouth guard, okay? It's almost like a retainer, if you've ever worn one. They're quite comfortable actually. I often wear mine as well. So what I'm going to do, we have a blank one here, okay, which obviously doesn't have your teeth fit into it yet. So what this will do, you just put it into your mouth, we'll hold it for 30 seconds, take it out, I will just wait for it to dry, and then your mouth guard should fit to your teeth shapes, okay? And what you'll then do is close your mouth, and when you sleep, just sleep with it in, it shouldn't bother you at all. And if you do grind, you're just going to be grinding down on this, not on your teeth, and it should protect them for a little bit longer, okay? So just open your mouth for me. That's good. Let's make sure that's firmly down. Okay, and just bite on that. Good. We're just going to keep it in for 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, let's take that one out. Good. Okay. It's a little bit wet, but that's okay. We're just going to leave it to dry in the box. So what that's going to do is just set. We need it to set. That's the most important thing. Okay. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay, I think this is done. So as you can see here, it's actually fit to your teeth and to your mouth shape. Can you see that? Alright, so now this is your personalised mouth guard. Okay, we can test it if you just want to pop that one in. There you go. Alright, if it's okay. Good, let's take that out. Put it in the box for you. So this is your own personalised mouth guard. Alright, so what I suggest is you keep it in this box. Alright, and you just want to keep it safe until you go to bed. Give it a rinse, pop it in your mouth, keep it in there the whole night, sleep with it in, okay, and when you wake up, take it out, and you can brush it like you would with your teeth, but just don't use warm water, make sure you use cold water, okay, and leave it to soak, and then you can wear it again the next night. Alright, but everything else regarding your teeth is absolutely fine. I'm not concerned at all. Everything looks all good and well. Alright, so you have absolutely nothing to worry about. Okay, so I'll give you the mouth guard. Alright, that's it, that's all for today. You're more than welcome. I'm just going to pop in here that we've done a mouth guard, and like I said, it's all included in the price. This should help you and protect your teeth, okay? There you go. Alright, just confirm your full name for me. Perfect, thank you. And what's your date of birth? Alright, great. Okay, so please tell me a little bit about what you've been experiencing. What's been going on? Okay. And is this why you've made this appointment? Okay. Okay. So you're feeling a bit fatigued? Okay. Dizziness? Okay. Alright. Okay, no, that's absolutely fine. Okay. So you just feel a bit low mood, fatigued, tired, exhausted, that kind of thing, low energy, and dizziness. Okay. No, that's absolutely fine. You were correct to make an appointment to come see me, so please do not worry. So, there are numerous things that could indicate why you're feeling like this. I can do a few checks today with a few tools that I have. However, I think, just based on what you've told me, I think it would be good to book you in for a blood test the next time you come. Yes. So, I am going to note that. Blood test. So we'll do an FBC, so full blood count, and we'll check your U's and E's. We'll also check for your B12. And have you ever had a blood sugar sort of check? Check to see if you're diabetic? No, okay, we'll do that. HA1. Okay. And we will test your magnesium and potassium. Okay, just make a note of what tests I'm going to put you down for your blood tests. Just because you're feeling a bit low mood and fatigued, I feel like you may have been lacking some nutrients. What's your dietary sort of like? Do you have any dietary requirements? Are you vegan, vegetarian? Okay, do you eat fruits, vegetables? Your nutrition is very important, yes. Okay, and do you have much calcium in your diet? I am going to check your calcium levels as well, actually, in the blood test. Okay, no, that's absolutely fine. I think I have everything here. We will definitely do a blood test for you the next time. I've just put on there everything I want to test within the blood test, alright? But I think what you've said, it's mainly... We'll do a check to make sure, but I think the blood test will tell us a little bit more, and that might be why you might be feeling low mood. Okay, so for today I'm just going to do a cranial nerve examination. I just want to check that the dizziness isn't because of your eyes or your sort of hearing in your ears, because sometimes that can make you feel a bit dizzy with your sinuses. Okay, and regarding your sort of low mood, low energy, I just want to make sure that everything is okay. Alright, so I will be doing that, and obviously checking your blood pressure as well, because that can be a cause for your dizziness. So we'll check all of that, and then we'll book you in for a blood test. Okay? Alright, so regarding sort of your facial nerve, your eyes, your ears, your mouth, your nose, have you been experiencing anything out of the ordinary? Okay. Any pain at all? Do you have any pain? Okay, that's fine. Anything else you think I should know about? Okay. Alright. Well, don't worry, I'm sure everything's fine. The symptoms you've given are quite common, and I just based on you and what you've told me, I suspect you might just be lacking something within your blood test, so that should be fine. Okay, what I'm going to do first, I am just going to check your breathing. Okay, so please just take a nice deep breath in for me and out. Good. Take a nice deep breath in and out. Okay, I just want you to try and relax. Okay, I'm going to be doing a lot of tests, so just try and be relaxed and don't worry. This is just sort of routine checks. Okay, so I'm just going to have a little listen of your chest, just to make sure your heart and your lungs sound okay. So I'm just going to pop that one on there. And I'm going to put that one there. Okay. That sounds okay. I'm just going to pop this behind your back. That sounds fine. I'm just going to pop that on your front and just take a nice deep breath in and out. Take a nice deep breath in and out. Okay, that all sounds fine. There's nothing wrong with your breathing. Your chest sounds nice and clear. Okay, so what I'm going to do now, I'm just going to pop this one on your finger. I just want to check your oxygen saturation levels, okay? So all you need to do is just pop your finger in there for me. That's it. So we want this to be above 96%, so 96% to 100% for your oxygen saturation levels. It would typically be lower if you had any sort of defects, so COPD or asthma. So, oh well, your oxygen saturation levels are 99%, 98%. That's very good. And your heart rate is currently at 75%, so it's absolutely fine. I'm just going to take that one off your finger. Very good. Okay. Next up, I'm just going to check your blood pressure. Okay, so I've got a machine here. And have you ever had your blood pressure checked before? You have, good. Okay, so I'm just going to undo the cuff, and if you could put your arm in there for me, that's it. So that's going to go right at the top of your arm, and where the line is, just there on the tube, that needs to be on the inside of your arm, just running along your main artery. Okay, good. So I'm just going to turn this on now. Okay, so it will make a noise and it's going to inflate, okay, and it will go quite tight, just to pre-warn you, so just keep your arm relaxed down by your side. So just going to start this. There we go, it's going up now. So just relax that arm, okay? Okay. So it's quite tight at the moment. Yes, that's fine. That's fine. Give it a few more seconds and it will deflate. So it's just counting down, it's working out your blood pressure. A normal blood pressure should be about 120 systolic over 80 diastolic, but usually anywhere between 110 to 130 systolic and about 60 to 90 diastolic is generally okay. So your blood pressure is on the lower side. It's 106 over 83, so your systolic is a little bit low, but you aren't feeling too well. Your pulse is actually 77, so that's accurate to the other one. But you've got a bit of dizziness and you're not feeling yourself, so I'm not too concerned. If it was under 100, I would be a bit more concerned, especially as you've been having some dizzy spells, okay? But that blood pressure is generally okay. Alright, so we're going to take this one off. Just take that off your arm. Good. Okay. I'm going to put that in there. Now, I do just want to note that down. So we've done your blood pressure. Do you know your height and your weight by any chance? Or roughly? Thank you. That's great. Okay. Alright. What I'm going to do now, I'm going to begin the main cranial nerve examination. So I've got some gloves here. I'm just going to put these on. Okay. And to begin with, we're just going to do your facial nerve exam. Okay, so I am just going to touch around your face. Just tell me if you feel any pain at all or discomfort or any tightening, okay? I'm just going to check the movement, alright? So we're just going to move that. I'm just going to rub your face. Forehead and your temples. Any pain at all? No? Okay. Just check under your chin and your jaw. Fine. No pain, are you sure? Okay. Feels okay, there's no lumps and bumps. Everything is moving accordingly. While I'm here, I'm just going to feel your ears. And your eyes are fine. Yeah. Okay. Alright, that all feels fine. Okay. Just move your neck. Just move your face. Good. Okay, that's absolutely fine. I just want to check your movement, okay? Let's just do a smile. And a frown. Good. And a wink. And a wink. And can you move your head from side to side? That's it, move it. And can you move it up and down? Okay. I'm just going to feel your shoulders. Any pain at all? No. Good. Okay. And just smile again. And frown. And wink. And wink. Good. And move your head. Okay, good. That's fine. Alright. What I'm going to do now, I'm going to touch your face with the tip of this, okay, and my finger. Tell me if it's this sharp one or soft of my finger, okay? What I would like you to do is just look straight in my nose, okay? Good. 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 Very good. Okay. And you can feel this? Can you feel that? Can you feel that? Can you feel that? Can you feel that? Good. Can you feel that? Can you feel that? Can you feel that? Okay. Can you feel that? Can you feel that? How about that? Can you feel that? Can you feel that? Can you feel that? Okay. Good. Now your facial nerve is absolutely fine. What I'm going to do now, I'm just going to have a little look into your eyes. Now, I think I'm going to use this one to look in your eyes and this one for you to look at. So we have an orange light and a blue light. Which one do you prefer the look of? I'm going to do the orange one first. Okay, so just look at my nose. I just want to have a little look into your eyes. look at my nose. Very good. Look at my nose. Good. Look at my nose. Very good. Eyes look good. Okay, and look at my nose. Just want to check this eye. Very good. Just gonna cover this eye. I just want to have a little look into you. Yeah. Good. It's fine on this side. Just want to have a little look. Okay. Could you just look that way for me? Good. Look up. And look down. And look that way. Good, okay. That's it. Keep looking up. That's it. Look up. Okay, look down. Look that way. And look that way. Okay. Alright. Could you just look at the light? Look at the light. 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 Okay. Follow this light. Okay. I'm going to try the brighter light, alright? So I'm just going to try this one. Okay. Look at the light. Good. Look at the light. Good. Look at the light. Look at the light. Very good. Look at the light. 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 Okay. Could you just follow this light for me? Follow the light. Very good. Keep following the light. Follow the light. Good. Yeah, your eyes are fine. Your pupil response is great. Very good. Yeah, that's great. Okay. What I would like to do, I would like you to just look here. 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 Perfect. Okay, look here. 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 Good. How many fingers do you see? How many fingers? How many fingers? How many fingers? How many fingers? How many? How many? How many? How many fingers? How many fingers? How many fingers? How many fingers? How many? How many? How many? Okay. Can you see my fingers? Yep, good. Can you see my fingers now? Good. Can you see my fingers now? Good. Can you see my fingers now? Very good. Okay, your eyes are absolutely fine. They're responding perfectly. Okay. What I'm going to do now, I would like you to tell me what colour pen this is. Orange. And what colour pen is this one? Pink. Good. Please follow the orange pen. Follow the orange pen. Follow the orange pen. Very good. Follow the orange pen. the pink pen. Follow the pink pen. Follow the pink pen. Very good. Excellent. Okay. Please could you now read this eye chart for me? So could you tell me what this one is? E, good. This one. L, T, good. Can you read this one? Perfect. And this one? Great. Can you read this one? Good. And this one? Let's get a little bit harder. Can you read this one? Good. And can you read the last one? You did really well there. Okay. What I would like you to do now is just read this one for me. What number do you see? 9. And what number is this one? 5. Good. What number is this? Good. This one? Good. Okay. No, that's absolutely fine. Alright. I'm now going to have a little look into your ears. Okay? Now, you said you had no issues sort of regarding your ears. That's correct, right? No hearing sort of difficulties. Okay. What I'm going to do, I'm just going to look with a bright light into your ears first. Okay. That's fine. On this side. Yep, that looks fine as well. Okay, what I'm going to do, I'm just going to use my otoscope just to have a little bit of a look into your ear. So, just got it here. There we go. Pop that on. Let's have a little look. Okay, your ears look fine. There's a tiny little bit of build up, but I'm not too concerned. I'm just going to have a little look on this side. Again, with that side, there is a tiny bit of build up. I'm not too concerned though. What I am going to do, I'm just going to whisper in each ear, and please tell me, repeat back to me what I say, okay? 1, 8, 5, 7, 4. Perfect. 10, 7, 5, 6, 1. Very good. 8, 21, 7. Good. 165, 4. Perfect. Alright. I'm now just going to have a little look into your nose. So I'm just going to use my bright light. I'm going to have a little look into your nose. So just hold your head up slightly for me. Have you had any difficulty with your sense of smell? Okay. Alright. Okay. Your nose looks fine. What I do have is a little bottle here. I would like you to just give this a smell and tell me what you can smell. What's that? Good, that's great. Well done. You did that one perfectly. I've got another one here. This is slightly different. Just give that a smell. And what's that one? Brilliant, well done. Okay, there's no issues there. Alright. Just have a little look with this light. Just up your nose. Yeah, your nose is fine. Just do this for me. Very good. Yeah, that's all okay. Alright. Now if you could, I'm going to have a little look into your mouth. So please just open your mouth wide. Okay? I just want to have a little look. Good. Lift your tongue for me. Good. And just say, ah. Ah, very good. Okay, that looks fine. I'm just going to use this light. Just open your mouth. Just want to check your tonsils. Okay, that looks okay. I have got a little tool here. I just want to have a little look at your teeth, okay? So I've got a selection of tools and I'm just going to have a little look at your teeth. Don't worry, I'm an expert at this. I'm not going to hurt you at all. So we're going to use this one. Okay, just open your mouth. That's fine. That's all good. Your teeth are all fine. How is your sense of taste? Okay, what I would like you to do is taste these. These are different to the ones you smelt. So I'm just going to put a little bit in here. Okay, and if you just open. Okay. There you go. What's that one? Good, well done. Okay, this one. Okay, open your mouth. And what's that one? Good, well done. Okay, wow, you have done extremely well today. I've checked absolutely everything. Your breathing was fine, your sound was fine, your heart rate was fine, your blood pressure was fine, your facial nerve is absolutely fine, your eyes, wow, your pupil response was great. Your ears are great. You've got a tiny little bit of build up, but I'm not too concerned. And your nose is fine, and your mouth is okay. Your tonsils are fine, tongue's fine, sense of smell is good, and your taste is good. Okay, so I'm not really too sure why you're feeling a bit low mood, fatigued. The only thing I can think of is whether you're not sort of eating and drinking is what you should be. So what I will do, I'm going to book you in for a blood test. Okay, and we're just going to check a few things to make sure your levels haven't dropped. But you will get informed about that. You'll get a letter in the post. Okay? But that's everything for today. Everything I've done, you're absolutely fine. I don't think there's anything to be concerned about too much until we get those blood results back, okay? Now, if you do feel worse or your symptoms get worse or new symptoms arise, please do come back and get yourself checked out, okay? Alright, well, thank you so much for coming to see me. It's been my absolute pleasure. Alright, well, take care. Bye-bye.